be used at all times during the reconstitution process. To begin, assemble the activase vial, the vial of sterile water for injection, USP, and the transfer device included in the activase package. Also, assemble alcohol swabs and syringes for the bolus dose and large bore needles. Reconstitute activase immediately before administration, using only sterile water for injection, USP, without preservatives, which is provided in the activase package. This preparation will result in a colorless to pale yellow transparent solution containing activase at a concentration of 1 milligram per milliliter. Reconstitution should be carried out using the transfer device provided and adding the contents of the 100 milliliter vial of sterile water for injection to the 100 milligram vial of activase powder. Begin by removing the protective caps from the top of the activase vial and the vial of sterile water for injection. Then, swab the top of each vial with an alcohol wipe to reduce the risk of contamination. Remove the transfer device from its wrapper and remove the protective cap from one end. Insert the piercing pin vertically into the center of the stopper of the vial of sterile water for injection, keeping the vial upright. Remove the protective cap from the other end of the transfer device. Holding the vial of activase upside down, position it so that the center of the stopper is directly over the exposed pin of the transfer device. Push the vial of activase down onto the transfer device, making sure that the piercing pin is inserted through the center of the activase vial stopper. Invert the two vials so that the vial of activase is on the bottom, right side up, and the vial of sterile water for injection is on top. Allow the entire contents of the vial of sterile water for injection to flow down through the transfer device into the vial containing activase, a process that requires approximately 2 minutes. About half a milliliter of sterile water may remain in the upper vial. Remove the transfer device and the empty vial of sterile water from the activase vial. Safely discard both the transfer device and the empty diluent vial, according to institutional procedures. Mix the solution with a gentle swirl or slow inversion. Do not shake. Slight foaming of the solution is normal. Let the solution stand undisturbed for several minutes to allow any large bubbles to dissipate. Activase will remain stable at room temperature for up to 8 hours after reconstitution. Do not freeze solutions containing activase. Visually inspect the activase solution for particulate matter and discoloration before administration. And remember, no medication should be added to infusion solutions that contain activase. Any unused infusion solution should be discarded. Administration of activase begins with preparation of the bolus dose. To review, the bolus dose of activase is 10% of the 0.9 milligram per kilogram total dose. The bolus dose may be withdrawn. Remove the appropriate volume from the vial of reconstituted activase using a syringe and needle. In this case, it is 7.4 milliliters. The activase bolus can be administered by hand. Administer the initial IV bolus dose over 1 minute. The remainder of the activase dose may be administered by inserting the spike end of an infusion set through the same puncture site created by the transfer device in the stopper of the vial of reconstituted activase. Peel the clear plastic hanger from the vial label. Hang the vial from the resulting loop. Sometimes the solution may be removed from the vial and delivered using a polyvinyl chloride bag. Because IV pumps and tubing vary, a standardized procedure should be initiated at each hospital to ensure delivery of the full dose of activase. No medication should be added to infusion solutions that contain activase. For more information about the dosing and administration of activase, please see the full prescribing information.